episode of Longevanity, where longevity and your best life meets inside outside wellness. And what I'm doing now is just pausing for a second while we get live across platforms. This always takes a painfully long 5 or 10 seconds, and then we should be getting ready to go. It looks like my streaming software is trying to connect right now to my Instagram. So hopefully this will just be a moment and then we will be good to go. So here we are. It looks like, of course, today it's giving some technical difficulties. So maybe we will go live to our YouTube and I will copy this later and upload to Instagram. So I'm just going to close with the Instagram now and we'll get started without further ado. So before we dive in today, I just need to make sure everybody is aware. I know we start this way every day, that again, today's content is really meant for hopefully interesting educational information, just an open dialogue about what is new and exciting. The important takeaways from this are it's really meant as educational content. This is not specific health advice because we're not interacting directly one-to-one. I want you to make sure that anything you see or hear today is meant for conversation starters with your own primary care giver. Please don't act on this as if it was your own medical advice without the guidance of your own primary caregiver. This interaction is not intended to diagnose, prevent, cure any disease. So again, please take it for what it's worth, which is, again, just to be highly educational and spark some interesting conversation. So with that said, I'm excited today. I have a guest with me. So we're just going to take a few moments to introduce ourselves because both of us are going to end up sharing this with our followings on socials. So I'm going to let Noreen go first here. So Noreen is joining us. And Noreen, why don't you just take a second here and tell everybody a little bit about what you do, your interest areas, where you're located. So let's start from there and then I'll do the same.
Thank you, Amber. It's so nice. I'm so glad to be here and thank you for having me. My name is Noreen Conley. I'm an adult nurse practitioner and I own the Ivy Hub Wellness, which is located right outside Boston. What we focus on is IV therapy, medical weight loss. We also do hormone replacement therapy, and we do labs in the office, which is an exciting new addition. We have 4 locations. There's one in Medford, Mass, one in Stoneham, Mass, one in Danvers, and one in Burlington.
Very good. So yeah, so you're on the sunny side of the south border there, but you're way up north like me. You're a northeasterner, so we have very similar climate to you guys. So for your
Yes.
folks who don't know me, I'm Amber Bachnick. I'm a physician just north of Toronto. Yes, life does exist north of Toronto. We wear
Mhm.
parkas most of the year. No, just kidding. We're finally getting to some nicer weather here. I was actually out on my back patio last night, which was delightful after such a long winter. So
Mhm.
I have a integrative practice. So we function sort of focus on health and wellness from the inside out. And so we do all sorts of anti-aging, basically from sort of promoting optimal health and wellness, very much focused on the pillars of health. So sleep, exercise, nutrition,
Mhm.
hormone health, full longevity, and on the outside to try to keep that outer image aligning as best we can with the inner. So we do non-surgical cosmetics here as well. So that's us in a little nutshell. So I thought today, because you and I have similar overlapping practices
Mhm.
around metabolic medicine and GLP-1s and hormones and advanced testing, that those might be some kind of fun areas to kind of compare notes, so to speak, and just sort of see what you guys are doing and what we're doing and what your patients are asking about and mine, and kind of go from there. So, Noreen, where do you want to start? What is sort of most of interest and pressing in your practice population? What are you guys talking about and doing?
Okay, the newest thing I said that we've added is comprehensive labs. And I'll tell you, it's been a real eye opener. I see a lot of I'm middle aged, and I see a lot of middle aged clients. And what really is a common theme across, across all patients that I've seen is high hemoglobin A1Cs. A hemoglobin A1C is your blood sugar over 3 months, and your red blood cell lives for 3 months, and that's why we can look at your blood sugar over 3 months. And high insulin levels. I've seen inflammation. It's just so apparent why people can't lose weight or why they just don't feel right or they don't feel like their old selves. there's a lot of things going on behind the scenes that are picked up with labs that you just may not see otherwise. So it's been a real exciting thing to see.
So if you were to sort of picture who that woman is as she comes through the door, again, not everybody comes in knowing what's wrong. They just know they're not right and they're not the way they were. If you were to describe her, what does she come in and sort of mention as her key things that she says are off or different that led her to book that appointment with you?
They struggle to lose weight. They used to work out and eat right, and that always worked like a charm, and that no longer works anymore. And then the other thing is they just don't feel like their old self. They have body aches. They have no sexual desire. They don't feel like getting out of bed in the morning. They have elderly parents and they're raising teenagers, and it's just a very stressful time. And to not feel good, not feel optimal health is a really hard thing.
I would imagine that'd be so frustrating. So, how do you normally like to start with them? So now she's there, she's in the office, you've been exploring some of these different things that have been happening to her. Where do you normally take it from there?
Usually we discuss getting comprehensive labs. We do more comprehensive labs than their primary care may do. And we look at everything. We do a complete look at their thyroid hormones, not just the basic. We go deep dive. We look at inflammation. We look at vitamin D, B12, their hormones, any inflammation. We do, like I said, very comprehensive that wouldn't be done in a normal lab panel. And we can really peel back the onion and see what's going on with these people.
I imagine they find that the other side of that coin versus like the testing that you're doing that is so much expanded beyond normal routine care because we
Mm-hmm.
have similar issues up here. Like up in Canada, we have a publicly funded system.
Okay.
But again, at first glance, that may sound like it is, all encompassing and wonderful. But the problem is it's very resource limited. And so what I mean by that, a struggle we have in Canada is that it's very much one size fits all medicine and sort of the base for everyone. And so one of the foundational problems here is it's hard to access routine blood work. We don't do a lot of that anymore, and it's very, very basic
Okay.
if you can get it. So that can be frustrating. The second side of that coin, whether I think it's Canada or the United States, is the interpretation of that blood work. I think conventionally trained people really focus on what they call normal values. And I don't know if this is a touch point in your office, but in our office, one of the things we frequently do as we're doing, first of all, similar to you, these advanced panels, is we're really diving into, well, what does normal mean? And really exploring that
Mhm.
normal values. I don't know if this has been a frustration point for your patients, is that they go and even if they do get lab work, they're told, oh, you're normal. Almost
Right.
like a dismissal,
Yeah.
as opposed to, or a diagnosis, oh, it's normal.
Yeah.
Whereas the whole concept of normal versus optimal, generally speaking, is not well explored. And for my patients, they're not really familiar with the concept. Well, I thought normal was the end of the line. Put a period at the end of the sentence. That's it. That's all. There's nothing more that can be done or offered me, right? And so we start into this conversation about how, well, normal is only a population statistic. Like, so we
Right.
develop normal values around 95% of the population. And people are really surprised up here, anyways, to
Mhm.
hear, oh, so you mean I could have been at the 90th percentile and now I'm at the fifth
Yes.
percentile, but I'm still normal. Is that right? And
Right.
I'm like, right.
Yes.
That's,
I'll tell you
do you
the
have those
labs I love.
conversations?
Yeah, all the time. And the labs that I love are, first of all, your vitamin D level is like the base in my book. It's a pro hormone. They call it vitamin D, but it is a pro hormone. And your level should be between 60 and 100. And if it's below 60, you get rundown, you get colds, flu. You're at increased risk for colon and breast cancer, and men are at increased risk for colon and prostate cancer when their level is really low. So vitamin D is the foundation, I think, to get everyone feeling, pretty good. The next one is B12, then it's thyroid, and then it's hormone replacement. And I think once those are all dialed in at optimal levels, people really start to feel like their old selves and they have energy and they have strength and they have the drive and they, want to do better in the world. And I feel like those are the core labs that really have to be optimal for people to feel really good.
Yeah, yeah. There's a lot of foundational work to be done there. For Canadian viewers, our numbers are a little bit different. Some of our numbers, our units are the same as in the US, but for vitamin D, normal is over 75. And again, people are more optimized over about 100. Of course, just putting out there,
Yeah.
again, we know this is not medical advice, that this is more educational, but you
Yeah.
actually can be too high with vitamin D. So this is one of those situations where optimal and in range is really important. So you should do this with testing and guidance, and being above optimal. Again, super therapeutic can actually cause problems. We lost Noreen for a minute, but I'll just chat here about vitamin D until she is able to pop back on the line. So vitamin D is one of those hormones and substances that also helps to bind calcium. The two go together. So if people run with critically abnormally high outside of the optimal range, reference range, then what can happen is they can end up having very, very high calcium. And this is definitely one of those types of minerals, calcium as well, where it has like I call it a Goldilocks zone. The story of Goldilocks and the three bears, the porridge too hot, the porridge too cold, and the porridge just right. So, similarly, certain things inside living creatures, of which humans are, have to be very biochemically balanced. And so, it's critically important to make sure that we have the right amount, that we remain in the Goldilocks zone. Otherwise, there are things that can happen. Oh, you're back. Here you go. I was just talking about why optimal for vitamin D is so important, because I was just sort of explaining I like my little Goldilocks and the three bears analogy, and the porridge has to be just right. If and this is why you do this under
Mm-hmm.
supervision, you do it with testing, is because if the
Yes.
vitamin D becomes critically high, with that will go calcium. And we used to
Mhm.
have a
Yes.
little mnemonic. It was moans, bones, groans, and stones. And that was sort of like the key symptoms. That's how we used to remember hypercalcemia, or too much
Okay.
calcium.
Yeah.
So again, moans, um, so again, very, very painful. Stones, you could make urinary stones, and it was like psychiatric groans. You can actually become cognitively affected. Like it can make you very confused and change your cognition transiently. So having super high calcium is not desirable. So again, more is not always better. Optimized is better. So this is again one of these critical reasons why testing is so important. So yes, we absolutely want a well-placed calcium, vitamin D level, but again, more is not better, optimal, and always under the supervision of somebody who's working with you to make sure your vitamin D levels are optimized. I'm not sure how much of that you're able to catch there. I know you're having some internet troubles at your end, so I'm trying to
All
fill
right.
in between when you're not there. I'll
Um,
start
I,
dancing in a second.
no, Amber, one thing I wanted to talk about was your new book.
Oh yeah. So we released a book down here. Here, let me put that up there. I'll put a little QR code. I'll try to be technical. Let's see if this worked. There we go. So this is our little QR code for our book. So this is all about,
I
again, I
love the
would
name.
say I am of similar vintage to you. So I called it hot flash to hot damn. So again,
I
trying
love it.
to
I love
make
it.
things a little better as we all go through. I share the same vintage. I am a Gen X gal, and
Yeah.
all of us who are at that age and stage, we are feeling it a little bit. So,
Yes.
this is actually a book to give tools primarily. The goal of it is to try to empower. It's really a book about empowerment and self education for self advocacy. If I were to sum it up in my little elevator pitch, if I was writing up and somebody wanted to know, it really is about self advocacy. So it walks the reader through what to look for as far as what are legit symptoms of perimenopause and menopause, which are frequently unrecognized, untreated. It's so much more than hot flashes and night sweats. Yes,
Mhm.
that's a part of it, but there's way more going on there, girl.
Itchy
And
skin, ringing in ears, itchy ears.
yeah,
Yeah.
everywhere, every system is affected. And so the book
Hmm.
brings the reader up to speed about what to look for and makes them far more aware of some of the different things that are happening, may actually be attributable to this, But more than that, it really is sort of a guide to have those guided conversations with your care provider. Because
Mhm.
most people who are going to read this book are not in my area or your area. So,
Mhm.
how do you get good care? How do you get good help? Well, I want to give you some tools because it's not easy. And part of the problem,
Mhm.
which is now just currently being addressed when it comes to women's health issues, is women's health issues historically have always been on the back burner.
Mhm.
And it is only since the Gen X women have been kind of coming into this age and stage that we see it advancing. Hollywood and some very prominent Gen X females have really been out there loud and
Mhm.
proud. And now finally it's having its time in the spotlight where women are getting more health care. So
Absolutely.
yeah,
Yeah.
so that's what we're focusing on there. You have a hormone practice too, I understand.
I do. We do hormone patches, pills, and we also offer pellets. I wanted to ask you, in Canada, are you guys having a shortage on the patch? Like my patients get
Yes.
like a different
That
patch
yes.
every time they fill the prescription because that patch is like, low on stock. And then, are
Yeah.
you having the same issues?
It's the same issue up here. We have a supply issue. This has just recently hit here about the last, I would say, I lose track of time. So I'm going to guess and say I started noticing this with my prescribing within the last 4 to 8 weeks. So
Yeah.
we're now critically short. And what we're doing now is converting patients over into creams. We have a gel preparation here that is available by pharma, and so we're doing dose
Mhm.
conversions and doing that as well. That's another option. So there are a few options we can move them towards. But again,
Right.
it's a shame. It speaks of the state again of women's health. Like what
Right.
I always find interesting when I talk to my other patients here, I finished med school. This is actually my 30th year class reunion for
Wow.
graduating.
Amazing.
I know
That's
it's like so long
amazing.
ago. But when I was in medical school, women were not mandatorily included in studies. In fact, actually, we were mostly excluded. And I'm not talking about women's health studies, I'm talking about cardiovascular disease, stroke,
Wow.
diabetes.
Yeah.
Because again, we cycle, and because our hormones are there, previously, big pharma would keep us out of them because we confuse the picture. So, again, there's
Mhm.
still some residual issues, gender issues around funding for women's health products, women's health studies, women's
Mhm.
health investigative work, again, through pharma and experiments. There's less resources still going to it. So, again, it's improving. The advocacy work people are doing, podcasts like this, more and more providers starting to make it a real focus. I think the
Mhm.
demand for change is there, and I think it's going to get better, but like everything,
Yeah.
it's going to take time. So,
Yeah.
absolutely, we are experiencing the same patch issues that you guys are.
Yeah. Interesting. Yeah. It's crazy.
Tell me a little bit. With our hormone practice, we're finding a lot of metabolic inflexibility. And just before I ask you about what you guys are doing, just to sort of tease you and give you a few things you can think about, we're using a little bit of low dose GLP-1
Mhm.
for some of our menopausal patients because one of the common complaints is this midsection weight gain. They are
Yes.
actually frustrated and already eating less and moving more, but it seems to be so unmovable. One of the big educational points we do here is talk about how there are definite shifts in metabolism with midlife. And with that, we have these metabolic flexibility issues. And so we're really seeing a role with GLP-1, even at teensy tiny
Yes.
doses, that seem to be helpful
Yes.
here. Or what's the thought on that by you?
Absolutely. We do the same thing here. I can tell you my own experience. I had a hemoglobin A1C of 5.4. I took a low dose GLP. My hemoglobin A1C, which is your blood sugar over 3 months, went down to 4.8 and it stayed there. And I take it sporadically. I'll take it like a low dose once every 2 weeks. But even that is so powerful in keeping my metabolic health in check. It's been amazing.
Just out of
Not,
curiosity, I know this is purely anecdotal. Have you noticed? Because if you haven't, I'll share some of the things my patients have been saying. Have you noticed any other non-weight, non-sugar related benefits on GLP-1 or that your patients have
you
been saying when they come in?
any more benefits than the weight loss? Is that what you're saying?
Yeah. Yeah. What have you been seeing for yourself or for your
Um,
patients that are
no,
seeing you?
some patients say they sleep better with it. They really like, that the food noise is shut off. They really like the, weight gain around the middle that's, dwindling down. But do you have certain things your patients have said? Because maybe you can jog my memory because
Yeah. I really find it quite interesting, and it just sort of speaks to the fact that this is not, I mean, my key point in bringing this up is I want people to know this is not a vanity product. This is not a shortcut, right? It's not the lazy person's, easy person's way out. So first and foremost, I want to make that really clear, because what we're seeing more and more, the more people who are widely adopting this, is multiple benefits across multiple systems. So for
Mhm.
example, one of the big things my patients will mention is that if they had a lot of joint pain, for example, we really think
Yes.
that there's quite a significant reduction in inflammation with the addition of GLP-1. And so some of my patients, we'd already initiated some of the regular, more conventionally as accepted hormone replacement therapy, and they were improving. But when we
Yeah.
added the GLP-1, mostly initially to drive the metabolic processes and some of the weight issues, they would come back within a visit, which for me is about 4 to 6 weeks later, and say, okay, what's the deal with my joint pain? Because I am much better, especially in the morning when I used to be so
Yes.
achy and sore. I'm not. And we're also seeing emerging evidence. This is new. So, again, bigger studies still need to be done. So, I don't want to be irresponsibly over promoting it, but there are things here that need to be investigated further. It really appears that it's not just reducing inflammation in the joints, but when it comes to aging processes, we look at inflammation in the small, delicate arteries and also in the vessels to the brain and into the kidney, where again, we've got fine, delicate vessels, that the inflammatory processes that happen with metabolic syndrome and metabolic shift inflame those delicate blood vessels, which create the backdrop for where we get hardening of the arteries and cardiovascular disease, which is the number one killer of women and men, but also
Yes.
women. It's a big women's health
Mhm.
issue, and
Mhm.
dementia. There may be a reduction that we will be seeing
I heard
with
that.
cognitive, with cardiovascular. Initially, they thought, oh, well, it's because of the weight loss. So with the weight loss, they have less blood
It's
pressure.
the
We've modified, but
inflammation, I
they're
think.
yeah, they've been dissecting these studies, and they're actually thinking it's its own independent risk factor modification in
Yes.
addition to some of the other things that are happening. So there's definitely going to be, I think, more and more research done and more work put into this. But I really think there's something going on with GLP-1.
Oh,
The other thing, too, is the cognitive impact with anxiety. Again, we already notice it quiets food noise, but we also think there's some quieting of some of these other things. And perhaps there's an inflammatory component, perhaps it's something else still to be determined, but there's definitely in some individuals, not everyone, but improvements in anxiety and other sort of obsessive or compulsive behaviors and the like. So
mhm.
it's expanding. It's really it's interesting. We got to look at it more. There's so much more to it. It's not just
I
vanity.
thought of I thought of other benefits after you started talking. I had one patient who was asthmatic, started taking a GLP and did not need her inhalers anymore. I had another patient who had colitis and said her symptoms were much better improved on a GLP. And then I had a patient who gambled and said she didn't want to gamble anymore since she started the GLP. And I also noticed people don't want to drink as much when they take it.
Yeah. So there's these associations. Right now, there's not enough study to cause
Right.
and effect. But as more and more people take this and these things keep getting reported, I am 100% sure there will be follow-up studies that will really try to
Mhm.
tease out where exactly these benefits are coming from. But
Mhm.
there's a lot going on there. So it's very
Mhm.
interesting. And so the only point I would want to leave with people viewing this if they've been skeptical and a lot of hype. And you're right. Like again, GLP-1s are not something that should be done without supervision. Um,
Right.
there are side effects that happen with them potentially, especially when they're taken without proper counseling, nutritional work, etc. But I think to keep an open mind, and if initially you were hesitant because you thought it was just, like the lazy person's way, a shortcut or a cheat, I think there's a lot more going there. And I would just encourage people just to be curious. You can still be
Mhm.
cautious and curious at the same
Right.
time, but
Yes.
be curious and listen, because I think coming, wait, let's get those studies out there, but keep your curiosity. You can hold curiosity and conservatism at the same time.
Mhm. Absolutely.
Yeah.
Yeah.
So no, I'm excited to see where that's going to go. But I'm definitely, I know it's just early days, but I'm definitely seeing benefits for my
Mhm.
patients.
Same, same.
We have
Yeah,
just a
spending
few minutes left together, Noreen. Is there some sort of parting words you want to sort of leave before we sign off together here, as far as, again, how to reach, how to find you? One of the things I want to do just to hear while you're sort of talking about things for follow-up, I just want to put up a little QR code for people who are watching and listening who are in the US, in your area. I have a QR code there that I just put up that goes directly to your website. So again, while you're sort of explaining sort of your take-home messages for the listeners today, I thought I'd just leave that up there so people can see you and find you.
Perfect. So if anyone in the Massachusetts area wants to make an appointment at one of our 4 locations, you can make an appointment with the link that Dr. Amber has put up. Also, our business is now a franchise. So if you would like to open a location somewhere in the US, that link is also on our website. And, we'd love to meet you. Thank you.
And then for my crew over here on the Canadian side, I want to just thank you again for watching. I know we talked about some very specific things today. So again, just as a wrap up, this really is just to stimulate curiosity and conversations and further reading and learning around these things. Please don't act directly on anything we've spoken of today without having some sort of discussion or involvement with your own primary care provider. We want to keep you on the safe side of the line at all times. If you liked the content you saw today and you want to be involved and follow with us further, let me just put up here our podcast. This is our link for our regular podcast, Longevanity. And again, sometimes we focus more on the cosmetic side of things, sometimes more the medical, the hormones, but pretty much if it's with the human body inside or out, it is open for discussion. So we'd love to have you ride along with us. And then if you're interested, if you're in the region and would like to come see us as a patient or learn more about what I do in my office, here's our website here. Just give that little code a scan and I would be delighted to work with you further. So anyways, that is all we have to cover for today. And Noreen, I just want to thank you so much. You're a trooper. We had some technical difficulties, but you're just right back on the line there.
Thank
And
you so much.
yeah,
Thank
we
you for
got
having
through
me.
it. You got through
It's been
it. I would
wonderful.
love to speak with you again and hope the
Okay.
sun shines for both of us very soon.
Oh,
For all of
let's
you
hope.
watching, we'll sign off and say thank
Thank
you.
you.
And